welcome to Therapy Thursdays, where we bring the therapist to you. I'm so happy that you guys are here with us. I am your host, Marcus Alexander Velasquez, and today's topic is a very interesting one, and I'm really excited to dig deep into this one today, especially with our special guest therapist. This word, this condition, however you want to describe it, is very prevalent in our society. Unfortunately, of course, and it's probably more prevalent than we'd like it to be, number one, and probably more prevalent than we actually like to acknowledge. So I hope we get some, I know we'll get some great knowledge today. We'll have some great discussion. Hopefully you guys and myself will learn some things today. And for those who are struggling with the topic at hand today, I hope that you're able to learn some more about the condition, and I hope that it drives you to seek out professional help, which is the whole purpose of the show. So, as always, at the beginning of the show, I read our disclaimer. As always, our disclaimer is that this show is for informational purposes only. You are completely responsible for what you do with the information presented, and myself and all of our guests cannot be held liable for any misuse or misunderstanding of the information presented. Please always consult a trained mental health professional before making any decision regarding treatment of yourself and others. So, we got the legal jargon out of the way. So today's topic, for those who have seen the promo for today's show, we are talking about depression. Last week we talked about anxiety, and our therapist from last week actually mentioned that a lot of times anxiety and depression go hand in hand. And oftentimes a person will be diagnosed with both of them. I'm very open and candid on this show. I believe that's when the best connection can happen, the best healing can happen. So I am an open book. The reason I have this show and decided to do this show is because I've gone through therapy on and off for about 5 or 6 years. I've grown tremendously from it. So I want to share this great resource with as many people as possible. And I'm very happy that so many therapists have signed up who believe in the show, who are here volunteering their time and their information. No one here is getting paid for this. We're doing this out of the goodness of our hearts because we believe in therapy, both as those who have received it, for myself, and then for the therapists who give it on a normal daily basis. These are real pros, real licensed therapists that have graced us with their presence on this show that I'm very happy and honored to have here. So we'll be talking about depression today. Our amazing guest therapist today is Miss Ro Bernardini, and I had the pleasure of meeting Miss Bernardini today. She was actually having some issues with her technical difficulties with her Instagram app, so I had the pleasure of going to her office in person and got to meet her. You're actually the first therapist on this list that I got to meet in person. So far, everyone else has been virtually. So, Ro, thank you so much for being here on the show. Welcome. If you wouldn't mind giving us a brief background of your work in therapy, how long you've been in therapy, and my favorite question to ask is, what drew you to therapy in the first place?
Hello, and first of all, thank you for having me. I'm looking forward to this, and hope everyone else is too. What brought me to become a therapist? Well, I had depression myself, and very painful for many years, and I went to a therapist, and he was good, but I needed someone different. And so I went to someone very highly regarded, and he helped me. I'm not depressed anymore. I used to have obsessional thoughts. Yeah, it is awesome. And I don't. And it's a terrible condition. People say, oh, I'm depressed. People say, oh, pull yourself up by your bootstraps. Get over it. Get over double pneumonia. Just pulling up your bootstraps. It doesn't work. You need someone outside of you who can hold up a mirror to you and see what you can't see about yourself. And slowly, unfortunately, but better late than never, people get better. And it's just astounding. I had a lady who'd been depressed for 25 years. She said, I can't believe it. I'm not depressed.
Wow.
Yeah. Depression, let's see. Well, they've known about it since ancient times because they have things written on hieroglyphs and whatnot.
Wow.
Uh, and it only in the last century and a half has it come forward to be more generic, more general. Sigmund Freud started it in 1895. His first publications in Vienna. I went to his home.
Wow.
Not when he was alive. And it's grown from there into many different directions, cognitive, dialectic, whatever. I use a mix of whatever works. And
Okay.
I tend to be more direct with patients. I'm from New York originally, and most people like that. Many of my patients have been to 3 to 5 therapists before they get to me.
Wow.
I've been practicing for 20 or 30 years. I got a master's degree in clinical social work from Smith College School for Social Work in Northampton, Mass, which is quite a thing to do, I have to tell you. After I got into therapy when I was in my early 20s, I thought, this is what I want to do. And all through my high school yearbook, it said, to a great friend and a terrific listener. Well, I was made for this profession. So let me think. Depression is treated, well, first of all, 1 in 4 Americans will experience depression in their life, major
Wow.
depression. Next, I had a person once who worked in the employment division for McDonald's worldwide. Next to antibiotics, antidepressants, all their employees. So depression is very, very, very difficult.
Wow. Yeah.
I have what I call the Statue of Liberty hypothesis. In Europe, I asked a friend who was European, how long has your family been here? And he looked at me like I was insane. And he said, we've always been here. Well, Americans have not always been here. And I think that has led to an intergenerational missing or unresolved grief. And hence a lot of depression, drug usage, drugs, sex, rock and roll, people escape. Depression is a biological, psychological, and chemical illness. It first often manifests as, actually not with a mood disorder, it first manifests as sleep interruption and
Wow.
change in appetite, like losing your appetite or pigging out a lot, weight change, mood, then the mood change, dysphoria comes in. This is caused by a deficiency of either serotonin and or norepinephrine in the brain. In the mid-1980s, they came up with Prozac, and I was told by the doctor, it's like sliced bread, best thing since sliced bread. And in many ways it has been for many, many people. Let me think.
So let me ask you, Rose. So the purpose of this show is to educate and inform. I also want to, certain words are used in society and they are abused, or people and situations are labeled with a certain term and it's not applicable to them. So I think the word depression is really thrown around a lot nowadays. So as a professional who's been doing this for so long, for our listeners, can you let us know what are the signs of a person who actually struggles with depression, as opposed to they have a bad day? And then what are the different types of depression? Because I know there's SAD, seasonal affective disorder, that can mimic depression symptoms. So what was that?
I have it. A lot of people have it, especially here, the goofy gray city, as we call it. Well, depression, there's many kinds. There's light depression, which is called dysthymia, but it's a medical diagnosis. There's major depression, which is the one I was kind of outlining. It's helpless, hopeless. There's nothing in the world that can help me. No one can help me. I'm hopeless. And to break that negative thinking cycle. There's seasonal affective disorder. There's a reverse to that too in Alaska, because during the summer solstice, the sun is out. Some people get overstimulated and go into mania.
Wow.
Amazing, isn't it? Anyhow, uh, it's there's certain chemicals in the brain: dopamine, norepinephrine, and serotonin. The Prozacs, which are called SSRIs, serotonin selective reuptaker. If you imagine between the cells in your brain, there's a big sponge. And anytime the happy juice, serotonin or norepinephrine comes down, the sponge goes and takes it away and destroys it. That's the biochemical part of depression. It's very real. It's not a joke. It is thrown around a lot, the word depression. It's a very serious and even life-threatening illness. What else? People come in, and some people don't experience depression, at least on the surface. People who often abuse drugs or alcohol or cigarettes even often have an underlying depression. And they use the drugs as a form of self-medication to kill their pain. Well, all it does is mess up their life mostly. So it doesn't in the long run pay off. Any questions you come up with thus far? Am I doing okay here?
No, you're great. Yeah. So, so you mentioned a lot of the chemicals in our brains and the chemical interaction with depression. Is depression always related to a chemical imbalance, or are there other issues that can create depression, such as emotional traumas, excessive grief, like if somebody lost someone really close to them? Are there other things, other causes of depression besides a chemical imbalance?
Well, depression is a part of grieving, and grieving is not pathological. It's a normal human experience. But to expect people to be on and off depressed while grieving is pretty normal. So don't walk away after you put away the casserole dishes after the funeral. People need support after. Major depression is much more biochemical, but so is dysthymia, the light level depression. It's just sort of, nothing's interesting, nothing's good. I'm never going to get out of this. It's really a malaise, and it's not as devastating as major depression, but it impairs functioning. It impairs sleep. If you don't sleep well, if you don't get into REM sleep, you don't rest, and you're sort of off kilter the next day. And if it goes on for days and days and days, it's terrible. Sleep deprivation is a real thing. In our society, too, people just push themselves incredibly. I mean, I had a patient once who said he only needed 3 hours of sleep a night. I
Wow.
said, you gotta... No, he did it. I don't know how he did it, but he did. So that's important. There's the rule of seeds. Sleep, eat what you eating, exercise, and doctor's orders. Seed. That's an acronym. And it means these are the things you need to attend to if you think you're depressed. I think those are things you need to attend to, period, for balanced mental health and physical health. Okay, I've had therapy myself. Very profound experience. That's why I chose this profession, and I've done it a long time. And I have to tell you honestly, I have never had one boring hour with a patient. Never. Always something new. Let me think. Depression is immobilizing. Some people can't get out of bed, and they have to push themselves. There's some kind of depressions that are related to narcissism, which is, in case you've heard this word has been bandied about these days, it means a person who's overly involved with themselves and thinks very highly of themselves. The depression comes when the person who thinks so highly of themselves, I call them king baby. When king baby, the flip side of king baby is I'm nothing, I'm dirt, I'm worth nothing. Human beings are just in the middle. Sometimes you're up and sometimes you're down, but you're not dirt and you're not a king. So I work with people about that. And I try to bring things down to an interesting level. I believe in humor in therapy. Um, I believe in the therapeutic setting should be like a holding environment, which is an auger. People don't know what that is. It's an environment which propagates growth
Mm.
and expansion. So I think that it's really funny because when you do therapy, in a way, you suspend your brain and you react out of your unconscious to the patient because their unconscious is talking to my unconscious, and generally it works. So that's really good. Let me think what else.
So I have a
Well,
question. Yeah. So I'm curious. So again, I'm thinking of I put myself in the position of our viewers. Some people here may be struggling with depression and either know it or don't know it. So I'm curious to know because, again, the purpose of the show is to inspire people to want to seek out professional therapy on their own. So I want to ask you, what is the what is the process like of seeing a therapist to help you with depression? And is seeing a therapist better than someone just finding some ways to help regulate themselves or just doing research on the internet and finding whatever they can find? Tell us what the differences would be for that.
well, I think therapy is not an intellectual process; it's an emotional process. So you can look on the internet forever, and you're going to get intellectual stuff. Um, it's an emotional process and a bonding between two people, one of whom's depressed, one of whom puts their self forward to help this person with this terrible illness, and that's exactly what it is. Um, what is the process of finding a therapist? Well, online there's Psychology Today has a an advertisement of therapists in your area by zip codes with their credentials displayed, and they'll have phone numbers and email and all that. You can contact a therapist on the phone or email. I generally like to talk to people because, I ask them, do you have privacy where you are? Because this is a very private thing. The next question I say, so what's going on? And usually they'll say, oh, I'm not getting along with my husband, or my son is something or other, or and I say, well, how about you? How are you doing with all this? Well, not so good, not so good. Stress increases depression.
Mm.
And every time you move houses, change jobs, go through COVID, you have stress. And lots of people are seeking out professional help these days, which is, I think, good because when I experienced, it was like, oh my God, there's hope, and I'm blessed for that. I truly am. I had a traumatic childhood, and I had gotten over these things. I like to help other people. I work with trauma patients who've experienced all sorts of traumas. I won't go into detail, but um, I once had a patient who'd been kidnapped. Oh my God. Yeah, amazing. So my patients, some stay a year, some stay 5 years.
Mm.
It's up to decide when they want to leave or discontinue. My words are, if you find a therapist, call on the phone, speak to them, see if you get a good vibe, see if you sort of click on the phone. If you don't, move on, because the bond or the relationship between the therapist and the patient is the key. It is the key. If you don't feel comfortable with a person, move on. Trust your feelings because your feelings will never lie to you. Your head will lie to you,
Mm.
but your feelings never will. So that's kind of how it is. People go for different periods of time. Some people they come back and need a retread, so to speak. Um, some people come in times of crisis. Mostly people come in times of crisis because who wants to go pay someone they don't know to tell them their problems? Speaking of that, not most, all insurances in the United States carry mental health coverage for the whole length of it. It used to be you can have 5 sessions and we'll pay for it. Well, great. Thank you so much, insurance company. Now it's, they don't say to a person with cancer, you can have 2 chemos. No, you wait until it's better. So thanks to Obama, we have a law that requires that. It's called the parity law. What else? So you got to find someone you like. You go a few sessions and it doesn't speak to you, move on. Or if you find out over the phone, it doesn't speak to you, move on. The other thing is people should not be controlled in therapy. Control suffocates people. Like if you grew up in a home where there's alcoholism or addiction or things like that, the addict is generally a control victim of someone else in the family. I've done family therapy, which is very interesting, but I don't do it currently, but if I need to, I do. It's very challenging. So control. Oh, I once had a family that had 7 children who were all asthmatic. And at least 5 of 6 days a week, they were in the emergency room with cardiac coding, etc. This was the most strangulating family I ever met. And this was 40 years ago or so, and I remember it very vividly. It's a privilege to be a therapist because people let you into their deepest soul when they're ready, but not before. And it's a privilege to watch people grow. And then you get paid for it. I believe in humor.
Absolutely. No, I think you hit a great point. It is a privilege. Again, I always want to make clear that I'm not a licensed therapist, but I thoroughly enjoy that same process of watching people grow, that aha moment where something they may have heard their entire life, but somehow I said it in a certain way and it clicked for them. I love that moment. I thrive off of that moment. Sometimes I need to focus on that moment more, that it's about others and not myself. And when they get that blessing, I end up getting blessed in the process. So it's actually really cool. We actually have 2 comments right now. We have someone left a comment. They said, I've been in therapy for a little over a year. It definitely helps to have a therapist. They help you find ways to sort out your feelings, emotions, and life events. Beautiful. Very well said. Thank you. Yeah, thank you for that comment. And then a second comment said, wow, that's so helpful. I'm glad you shared that. I'm sure many people don't know. Awesome. That's exactly what we want, to bring awareness and some education to people who either don't know about these things or know wrong information, and we want to help correct some information. So, Ro, there's a lot of people that join this show because they're interested in therapy, but for one reason or another, they just never followed through with signing up for professional therapy. I know from myself, when I started, I didn't have anyone to hold my hand through the process. I was really the first person in my family, at least that I knew of, that was seeking out not only therapy, but long-term therapy. And so it was a very tough process. And I love sharing that because I want to be honest with people. For those who are interested in therapy, it is not an overnight thing. It is not one session and you're good to go. It can be a very rough road. I remember there were times where I was fighting and not knowing if there was light at the end of the tunnel. So I'm very grateful that I had a good experience in therapy and have grown from it, which is, again, why I share it with people. So most people, if not all people that are watching the show, have not been to formal therapy. So in an effort to ease tension and help people understand the process, Ro, can you help us understand, and just a general overview? I know we're not going to get to specifics, but give us like a general overview of what your plan is when you are treating someone with depression.
Okay, when the first session, I do this unconsciously. I take a mental snapshot of them. Then I take a mental snapshot of them when they're finished. They're different people. They look like different people. Um, okay, everyone's stressed when no one comes to therapy because they're happy campers. Um, so they're stressed. How do I help them? Well, I tell them a few of my rules. If you're in danger, call me 24/7. I don't care. Call me 24/7. Um, and if you miss an appointment, you have to pay. But let me think. What I tell them is this is not an intellectual process, although we Americans, checklists, check, check, check. We work that way. But it's an emotional process, and it's like a trash compactor, oddly enough.
Hmm.
You ever seen a trash compactor? All the trash goes in and it's all squished down. Well,
Yep.
therapy, that's the mental trash compactor open up and things begin to percolate out. Feelings that you've been split off from. Depression is alienation from self and others.
Hmm.
A lot of people talk about being in a cage or looking at life through, like looking through a window. And that's the being split off from yourself. It's like you observe yourself, but you can't quite get and connect with people, even though you may have developed, most people do, what some people call the imposter self, the one that gets the public self, which, I've got it all together, yada, yada. And, but the real self is different than that. And we don't let many people in. The therapist should. If you don't feel comfortable with a therapist, tell them. If they don't address whatever issue, move on. A therapist should make you feel comfortable, accepted, um, and accepted. For example, I had a patient who said something a little bit offensive to me. And instead of saying, oh, that's offensive, I said, I embrace that concept, which is I embrace you, even though you have this side of you don't like. So that's part of it. Therapy, there's a beginning, a middle, and an end phase. And the beginning is pretty short. The end phase is pretty short. The middle phase goes on until it's ready. It's like cooking a stew. When the stew is done, you then end it. And the therapy. And comparing ourselves to stew is a bad thing. Um, but it takes a while to gestate. Well, think of a baby being born 9.5 months. So therapy is like giving birth to yourself.
Wow. Well said.
Thank you, thank you. I think that's about all for right now. But any questions or comments?
We did have one more comment. The earlier comment about someone saying that was so helpful was about the insurance comment that you made, that they won't give you just a few sessions, that they'll give you enough that you can finalize the issue at hand. We do have another comment that says, so many people do use this term lightly, and I did too, until I finally reached a deep depression that took a very long time to get out of. I do find myself feeling down when overly stressed. And then she also said, such a great topic to shed light on. Thanks. Great. Awesome. Thank you for your comments. I do
Really?
have a question. And just so you guys know, at 7:30 is when we open up to questions and answers. If you have any questions for myself, if you have any questions for Ro regarding depression or anything therapy and mental health related, please type them in the comments. We would love to answer your questions to the best of our abilities. So please now take the time to start writing in your questions, and we will make sure that your questions get answered. So in the meantime, Ro, in your experience, what are there signs or a certain timing or a certain experience that you've gone through where you realize that medication is needed to treat depression? Are there certain signs in a person's life that lets you know, okay, they may need the assistance of a medication?
The signs are that if you're depressed more than 2 weeks, that's a sign you need treatment for depression. If it goes on beyond that with the therapist, if you're suicidal, you have self-destructive thoughts, if you're cutting, if you're um, doing dangerous behaviors, those are usually signs of depression turning against the self. So oftentimes, I had a lady come in, and terrific lady, and she didn't want to use medication. Okay, fine, whatever. And I every now and then would bring it up. And finally, she agreed to take just a smidge of Zoloft. She said it changed her life, and she only regrets she didn't do it 5 years sooner.
Wow.
And if you're biologically depressed, you know, it's real. It's like your body isn't producing the right chemicals, or if you're producing them, but they get destroyed in the process. So before 1986, we didn't have any good antidepressants. Now we have many, like 10, 12, something like that. And most people get some relief from the antidepressants. Some people use a combination of antidepressants. Some people use Zoloft and Wellbutrin, which one, Zoloft works on serotonin and Wellbutrin works on norepinephrine. And those are the two things oftentimes that get just the sponge sucks them out of your brain. So that's it. Medication is, especially if you're really immobilized. And some people come in, they can barely get in. Seriously, it's terrible. And I just feel my heart breaks for them because I know they're really suffering, and I do all I can to help ease the suffering, let them know there's a place where there's pretty much unconditional acceptance. And I tell the truth. The truth is ultimately the deepest form of empathy.
Mm.
Yeah, isn't that nice? And sometimes you don't like the truth. It's all right. You'll get used to it. We all do, hopefully. Yeah, so that's medication is very a nice adjunct. I work with psychiatrists who are specifically trained in, prior to like the 80s, psychiatrists did talking therapy only. Now they prescribe drugs. Most of them do that. They do talking therapy also. The key thing is if you need meds, you go to a psychiatrist. Don't go to your regular doctor because they're good, but that's not their specialty. Also, if you don't feel like the meds are helping after 6 weeks or so, a month usually they give you to get used to it. And it does take 3 weeks to a month to begin to kick in. So you have to be patient with it. And if the first one doesn't work, there are many more out there that could work for you. I had a lady who for a year and a half, she went through every medication on the planet, I swear. And finally hit the one. And bingo, she was a new person. So everybody has different biochemistry, and the doc has to figure out what your symptoms are, which pill or medication will best respond to that, and then work with a therapist like me. And I work in conjunction with doctors. I often talk to them about a patient. How are they doing? What are they on? They'll ask me how they're doing in treatment. What are they discussing? Are there any issues that have come up that the doctor should have addressed? So it's a real community effort. So does that answer your question?
Yeah, for sure. And I want to make a distinction for our audience too that seeking out a therapist for depression doesn't automatically mean you're going to end up on medication. That's
Right.
just one option, but that is not the first option. Of course, the therapist, like Rose said, will evaluate you first, see where you're at, and then give remedies that are applicable to your situation. So it's not going to be an immediate thing, and it's not guaranteed that you'll even end up on medication. That's not for everyone. That's not required in every case of depression. But there are times where it's warranted. Of course, it's your choice whether you want to be on medication or not. So it's interesting because I want to be able to share my experiences when and I shared this with you earlier today, Ro, my first therapist, when I was seeing him, he actually misdiagnosed me. And we keep it real here on this show. Therapists are amazing, they're trained, but they're still humans. You have to remember that. So nobody knows what's best for you other than you. So always advocate for yourself. But this therapist told me that I was bipolar. And as soon as he said that, I knew in my mind he's wrong. He's 100% wrong. Like, he gave me that diagnosis, and I just gave him this weird look, like, I'm not bipolar. But of course, to be honest, it made me question at least a little bit in that moment, because this is the pro. This is the guy I should be trusting. So I learned a valuable lesson from that I'm able to share with you guys, that still be willing to question certain things. Again, nobody knows you better than you know yourself. So the situation with me was that when I started therapy, I had years and years of repressed emotions that were now coming to the surface, that now I was able to actually process and deal with, that I wasn't shoving down and ignoring with all my own vices. So what happened is, in the beginning of therapy, my emotions and behavior was erratic. There were times where I had these big waves of emotion. I would cry and anxiety. So I understand his point of view, why he thought I would have been bipolar. But the reality is, it was just years of repressed emotions coming to the surface. And eventually, everything leveled out. I pretty much got caught up to present day with all the emotions. And then I was more regulated. So to be honest, with therapy, sometimes it gets worse before it gets better. Because, go ahead.
Usually it does,
There you go.
unfortunately.
Yeah, but you're in the right place for things to get ugly, because you'll have a trained professional to walk with you throughout your path and throughout your journey. We have
Right.
a question here. The question is asking, shed some light into anxiety or panic attacks, and should they seek help from a therapist?
Yes. Yes, they should seek help from a therapist. Panic attacks are actually, I used to have them. I mean, like, I'd be in the theater and I'd like, I gotta get out. And I would literally slide out the theater and go, couldn't breathe, thought I was having a heart attack, et cetera, et cetera. And I got over them.
Hmm.
Panic attacks are actually a phobia of feeling that is the trash compactor is letting up, or that what happened to you. When your first therapist thought you were bipolar, well, you weren't. You were just releasing things that have been repressed. The body and mind work together, thank God. And the panic attack is a sign that actually you're getting better, oddly
Hmm.
enough. It means the stuff that's been repressed or squished down is percolating upward. And while it doesn't tickle and it's not fun, to say the least, um, it's actually progress. Generalized anxiety is a different thing. Anxiety and depression go hand in hand. Um, some people experience more anxiety than depression, some people more depression than anxiety. I personally experienced more depression. I thought, oh, anxiety, that's the good stuff. Um, really. And it wasn't good. But the deal is, anxiety is a warning signal. It's a signal anxiety. Things are coming up I can't cope with, and I'm going to have nervousness. I have to go on a job interview, and I'm anxious. I have to fly a plane in planes. I don't like that. I'm anxious. Um, so those anxiety is very treatable. They use Zoloft is actually very helpful with anxiety. The other thing about anxiety is I had a patient. Well, it's about tension regulation. She would just blow up at everything. She broke a fingernail, she'd blow up about it, whatever. And she went on Zoloft, just a smidge. She's a new person, a new person. She doesn't blow up anymore. I mean, it's about regulating tension. And if your body is, your biochemistry is out of whack, you're in a state of chronic tension. And that could lead to anxiety and panic attacks. But like I said, panic attacks in a weird way is the good news. So, that
Wow, that's
answer?
great. Yeah. I'm curious too. Again, if this is the question portion, so if you guys have any other questions, please feel free to add them in the comments. We actually have another comment from the same person who asked the question. They said, "Thank you. A lot of people do not know how to read their body. Medication is not always the answer." Very, very well said. Yes, thank you so much for that. It's very well said. So the thing is too, like, when it comes to therapy, we're still we're still in the process of destigmatizing therapy. So, you know, if somebody feels like maybe something from this episode, something depression related, they're recognizing certain symptoms within themselves and they may benefit from formal therapy, but they are embarrassed because it's still unfortunately kind of a societal taboo. What would you say to someone who may think that they can benefit from therapy, but they're worried about what people will think, or they think if I go to therapy, it means something's wrong with me or I'm crazy? Like, how would you advise them?
What I would say is therapy is a place to find comfort, and that don't tell people if you don't want to. You don't have to, and let them think what they're going to think, because you can't control what people think. And do you like those people? You know? So it's your life. You have to take care of yourself, number one.
Absolutely. The same person, they put a comment, they said, being in therapy is cool. I agree. Being in therapy
I
is very cool. Yeah. And
and
honestly, you know, some people will say, oh, well, you go to therapy because you're weak. To be honest, there's two answers to that. Number one, we're all weak at some point in time. So to avoid that is just lying about the human experience. We're all weak in certain areas. We all have strengths in certain areas. Secondly, going to therapy is for strong people because they're the ones who actually want to face their issues and get better. You know, it's real easy to ignore the issues. It's real easy to drown yourself in your vice of choice, whether it's drinking or drugs, whatever it may be. That's the easy stuff. So when somebody knocks you for going to therapy and says, oh, you're weak, oh, you need someone else to help you in life, I'm here to tell you right now, and I'm sure Ro will agree with me, that you are the strong one. You're the opposite of weak. The fact that you are willing to be honest with yourself, the fact that you are willing to look yourself in the mirror, look internally, and be honest with what you find, that's difficult. Facing the ugly truth inside of us can be very difficult. It can be very painful. And, you know, it's truth. So the truth shall set you free. So Rose said that, you know, the truth, you may not like it at first, but it's there for you. It's there to help you. But like we all, like we were created for relationship. And the same thing that Rose said, that a therapist is just another relationship. But this relationship is with somebody who is actually trained and licensed to explore your mind and help you with things. So every now and then some people will say, you know, oh, well, I'm not going to go to therapist. I'm just going to talk to my best friend, or I'm just going to talk to mom. Or some people say, oh, the gym is my therapy. And that's just not true. I'm sorry to burst your bubble, but it's just not true. Now, talking to those.
you're breaking up. Just a second, folks. Breaking up.
You end up better. You end up better at the end than when you first came in. And that's the beauty of therapy. Ro, do you have anything you want to add to that?
Yeah, I think I agree with that. The pixels are not you've gone pixelated. You get better. Yeah, you're a better, different person in some ways. I think a more evolved person is self-actualized more, and self-actualized in terms of you don't let people walk on you. You stand up for yourself. Not always, but you know, no one's perfect. No treatment is perfect. But when you go to therapy, the therapist has no agenda other than to receive payment and to help you. Well, it's true. Although I might do this voluntarily if I had to, because I enjoy it so much. But the therapist doesn't have a program like, should you leave your wife? Should you stay with her?
Ro's signals cutting in and out. Ro, I have a question for you. Are you accepting new clients?
Yes, I am.
I'm sorry, you cut out for a second. Are you accepting new clients?
Yes.
Awesome.
Absolutely.
So I'm glad she said that. I want to remind everyone that not only is the purpose of the show informational, but we actually want to connect you with our wonderful therapists that come and volunteer their time. So if you can go to my page when we're done with the live, and if you go to the link in my bio, it will bring up several options. The third option down says Therapy Thursdays. you're going to click on that button and it will bring up an online spreadsheet. This spreadsheet has the information, the contact information for every single one of our therapists that we have on guest. So if you find a particular therapist that you click with, that you connect with, we want you to connect with them. So please click the link in my bio, click the third option down. This is Therapy Thursdays, and Rose's information will be on there. You'll find her phone number, her email address, where her office is located, the types of insurance she takes, any specialties that she may focus on, if she does online telehealth, all those things. Please click the link in my bio to find that information, because we want to connect you with real life therapists, because we are devoted to your health, devoted to your wellness. And again, we know the overwhelming benefits of therapy, and we want to share it with as many people as possible.
Thank you.
Do you have anything to add to that, Ro?
Yes, this is wonderful. I have to tell you, I'm enjoying this too, and hope to do more in the future. My practice is actually low, oddly enough, but I'd be happy to receive referrals. And I work with people. I don't work with children under 7 or 8, or actually under 9 or 10. I work with everybody after that, 10 years old to 100. I had a patient who was 95 who'd been in a concentration camp.
Wow.
Unbelievable. 95 and roaring.
95 and roaring. Wow.
So anyone
Awesome.
of any age, and when you go to a therapist, depending on what age you are, make sure the therapist is about at least 10 years older. My other suggestion is, if you find out you're going to a clinic or something and they're giving you to a student, move on. I was a student once, and I think of the people that I thought I was treating, but it takes years to make a good therapist. So make sure they have some time under their belt. Someone's putting little hearts up the screen.
Yeah, that means they're showing love and they like what's being talked about.
Oh, good. Thank you, whoever you are.
Yeah, we actually have a couple more comments. It says, thank you for pointing out some of these things that I tried to depress, and now knowing that going to therapy will help. Awesome. That is literally the purpose of this show. Again, if you guys have any questions, we have roughly 12 minutes left. Please type them in the comments. We'd be happy to answer them. In the meantime, Ro, of course, we advise for anyone to go formally see a therapist, sign up for formal therapy. The therapist knows what they're doing, and they will help walk you through the process. But in the meantime, are there any practical tips that you could share with our audience on ways that they might be able to help regulate themselves when like a depressive episode comes on them?
Please, sleep, eating, exercise, and doctor's orders. Seeds. So that's the thing. Exercise really is very important if you can make yourself do it, or get a friend to help you make yourself do it. And that would be really good. Eating non-junk food would be a smart move. And sleeping, if you're having sleep interruption, you might want to see your regular physician. There are also sleep clinics at the major hospitals, Rush and Northwestern, and I'm sure the other ones have them too, and where they hook you up with electrodes and find out why you're not sleeping and give you recommendations if it's prolonged. What else? What else can they do? Talk to a friend. If you haven't gotten to a therapist yet, keep calling till you do. Let your friends know you're really hurting. Let people have 3 people you can call 24/7. Mom, your cousin, your next door neighbor, whoever. Just someone who can be there for you if you're having a really hard time. And that's basically what I think about. So.
That's great. I think one of the unique perspectives that you have is that you said you went through depression as well, which I think is phenomenal. Some people can only understand so much based on learning. I believe that experience is the best teacher. Can you give us, as much as you're willing to, can you give us a brief overview of what your process was like being on the receiving end of therapy and what it was like for you as you eventually conquered depression?
Well, okay, sure. I went for a while in my mid-20s because I was so depressed and I was miserable. I mean, like, I'm surprised I could get out of bed. I was so depressed. And that was very helpful, but it was very intellectualized, actually. Why is this? Why is that? Well, why is not in many ways a useful question. How come is better, it's easier, goes easier in the ears. Because, it's, like I said, the trash compactor has to lighten up, let the feelings out. What was my process? I went to several different therapists because I wanted to try and find out. Some of them I went into one and I asked what the fee was, and he said, well, X amount. And I said, well, okay. And I wrote him a check and said, this isn't working. He was not amused, but that's okay. Um, so my process was finding the right person who was smart enough and who was compassionate enough, because I can be a pain in the neck sometimes. But who can't, right? So that was finding the right person is the key. And if you can't find them, keep looking. So you'll find a lot of people who are good, but they may not be good for you. So, and if they talk only, if there's a therapist who sits there and says, "Now, how does that make you feel?" Move on, because you need someone who's going to motivate you. And yeah, we need to know how you feel, but we need to know why you're feeling that way and how come, or how come you're feeling that way, not why. But what is triggering you to feel that particular way? And then you go back and you just like digging in the garden, you find a little root, and then you follow the root and you follow the path and find out what's really, really bugging people. I had a
Well,
patient who'd been sexually abused who didn't tell me about it for 7 years.
wow,
I asked, she just didn't want to talk about it,
wow,
but
that's
she
great.
got better.
That's wonderful. You brought up a great point, and we actually have a comment now that piggybacks off of it very well. Let me ask you, how many therapists did you go through first before you really found the one that worked for you?
Many.
Many.
I
Yeah,
at
so
least
our
five.
comment, at least five. Wow. So the comment here said, I went through three therapists until I found my perfect fit. And I think that's a great point, and I will drive this point home over and over again. I have no problem repeating myself because you know, trying out therapy on itself can be risky. It's already a scary thing to do for some people. It's admitting that you don't have everything all together, that your life isn't perfect, that you need help from an outside source. So all that's already being vulnerable in this position. But then it is possible that you may go to a therapist that may not be the greatest, and you can have a bad experience that puts a bad taste in your mouth. So right here, the comment we had said this person said they went through three therapists until they found their perfect fit. Ro went to, by her own admission, at least five therapists before she really found the right fit. I myself, thankfully, I found my therapist on the second round. The first one, like I said, didn't work out for me, but the second one did. So that's the reality. It's kind of like finding a personal trainer. Like some people just fit you better. Some you might go to the first personal trainer and they're yelling at you saying, "Oh, you're weak and this and that. Come on, push." You may not react to that well. You may need positive enforcement instead of negative reinforcement.
True.
So it's really about trial and error sometimes. If you find the greatest and best therapist for you on the first try, awesome. Bless you. Great
Awesome.
job. But if not, please keep searching. Please keep fighting for yourself, for your own health, for your family, because it's worth it. It's worth the fight. It's worth seeking out outside help. And please don't let one, bad experience or bad apple ruin the process for you, because therapy is an amazing tool. And we would hate for someone to have a bad experience or for them to stop seeking healing because of that. We do have
Fairness to
another.
me, two, three,
Go ahead.
four. I with therapists two, three, and four, I wasn't there very long. like a
Wow.
few sessions,
Wow. There you
just
go.
a match.
We have
A match.
another comment. We have another comment here. It says, "Thank you for your time and insight on depression and anxiety. Just knowing there's plenty of help out there. You just have to open your heart and mind and trust in someone." Very well said. And that is very true. In order for therapy to work to its full effectiveness, you have to open your heart. You have to be vulnerable with someone. So being vulnerable, of course,
Not
go ahead.
immediately. It takes process over time to trust them to really open the door wide.
Absolutely, yeah. And talking about vulnerability, vulnerability can be a double-edged sword because it opens your heart to love, to healing, but of course it opens you up to possibly getting hurt too. So that's why so many people will close their heart because nope, nobody's ever going to hurt me again. But when you close that door, you also close that door to love, to help, to healing. So it is a risk, but the risk is worth it. And just be careful, be wise with who you open your heart to. Don't just open it to anyone. Not everyone deserves access to your heart. But find someone, do your research, use tools like psychologytoday.com to find credible, great therapists, and then give them a chance. That's the only way to utilize this amazing tool is by giving people a chance. We do have one last question, and we'll wrap up with this one. The question says, how many sessions should you give a therapist before moving on?
Until it doesn't feel right. And then you bring it to their attention. I don't feel right here because of ABC reasons. And if they address it and do well with it, stay. If not, move on.
Wow.
The other thing I tell people is regarding trusting people, share, check, share. You share a bit, then you check. Am I feeling okay? Is this person cool? Is this helping me or hindering me? And if the answer is they're cool, you share some more, a bit. And you slowly get to know people. So
That's great. Awesome. I do want to remind you guys again that if you'd like to get in contact with Ro or any other of our therapists that we have on as guests, please click the link in my bio. It will give you an option to click a button called Therapy Thursdays. That will bring up an online spreadsheet that has all the information for all of our therapists and how to get in contact with them. Please, please, please don't let the experience stop here with this show. This show is meant to spark something in you, but this is not the full process. This is merely to introduce you to the world of therapy, introduce you to someone like myself who has benefited from years of therapy. This show is to introduce you to amazing therapists like Ro, who, so you know that these are real people. The therapists are real people, that they've gone through their own issues as well, but they are willing to walk with you through your process. So there could be a disconnect between your average person and this amazing medical field and help that's there. But my purpose is to bridge that gap for those who are either afraid, don't know how to get over here. This show and my life is to help people bridge the gap, to say, come on over. I've tested the waters. I've done this. I've improved tremendously. I can vouch for these therapists. They're wonderful. This process will help you a lot. And to go after, man. If you really want your healing, go after it wholeheartedly. We had a last comment, then she said thank you to both of you. So that was very nice.
I was going to thank our wonderful moderator, and thank you all who decided to tune into this. It's my privilege to teach you. So Godspeed.
That's great. So I'm going to finish up with our disclaimer. As always, our disclaimer is that this show is for informational purposes only. You are completely responsible for what you do with the information presented, and myself and all of our guests cannot be held liable for any misuse or misunderstanding of the information presented. Please always consult a trained mental health professional before making any decisions regarding treatment of yourself and others. Ro, it was an absolute pleasure to have you on the show. Just so you guys know, the lovely Ro has signed up for several episodes, so she will be a reoccurring guest on the show. I'm very excited about that. So, Ro, thank you for being here. Do you have any final words?
This has been wonderful for me. I hope the people who listened in feel they got something of value from it. So that's it.
Awesome. Wonderful. Well, everyone, thank you for checking in. As always, we have Therapy Thursdays every Thursday from 7 to 8 p.m. Central Standard Time. Please join us next week. We will be here on Instagram Live. Ro will actually be joining us next week as well, so you'll be able to see a familiar face then. But please continue to join every Thursday at 7 o'clock. Please let your friends and family know. The more people, the merrier. We want this information to get out to as many people as possible. So thank you for tuning in, and have a good evening.
Work.